morning, Ma'am Lindsay de la Serna. I am Michelle and I will be your student nurse for today. So what would you like me to call you?
Lindsay will be good.
Okay, so for today we're going to assess your head, eyes, ears, nose, neck, and throat. So shall we start?
Sure.
Okay. So Ma'am Lindsay, I'm going to proceed to inspecting your hair and your head. So is it okay if I touch your hair and head?
Yes.
Okay. Dandruff or lice. There are no lesions or any scars on the head. Head size seem to be normal. So I'm gonna palpate your head. I'm just gonna touch it and tell me if there's any pain, okay? You feel any pain?
No.
How about here?
No.
Okay. So patient's head size is normal. Hair is normal and it is smooth to the touch. No lesions, no dandruffs or any lice. So now we're going to proceed to assessing the face of the patient. So the palpebral fissure seems to be symmetrical and normal. So ma'am, could you smile for me? So the presence of nasolabial folds are present and symmetrical on both the left and the right side. I'm going to proceed to inspecting or assessing your eyebrows. It seems to be symmetrical on the left and the right side. So can I touch it?
Yes.
Okay. So the distribution of the hair seems to be even and normal on the left and the right side. So the patient's eyelashes are evenly distributed both on the left and the right side. Both are symmetrical. So ma'am, could I just touch your face? So the patient's eyelids seem to be symmetrical also, both on the left and the right side. So ma'am, could you close your eyes tightly and then open them up for me? Okay, open them up. So patient has no trouble opening and closing the eye. The eyelids are covering the part of the sclera, which is normal. Now we're going to continue to assess the patient's palpebral conjunctivity. So ma'am, could you look down for me? Okay, so I'm gonna pull on your lashes a bit, okay? Remember to wear gloves as you do this procedure. Okay, could you blink for me? Now the other side. Okay, blink for me. Do you feel any pain?
No.
So there's no swelling, no presence of foreign objects, or any pain felt by the patient, as I did check the palpebral conjunctivate. So now I'm going to proceed to palpating the lacrimal glands of the patient. Ma'am, is it okay if I touch your face? Okay. So there seem to be no swelling and everything is normal with the lacrimal gland. So now I'm going to proceed to touching the nasolacrimal gland. Can I touch your face again, ma'am? Okay. Do you feel any pain as I touch it?
No.
Okay. So patient feels no pain and there is no presence of swelling. So now I'm going to proceed to assessing the conjunctivity of the patient. So ma'am, is it okay if I touch your face again? So could you please look up? Okay. Patient's conjunctivity is pinkish in color. There seem to be no foreign bodies or any type of swelling or infection. So patient's conjunctivity is normal. Now for the sclera and the cornea. Patient's sclera looks perfectly normal, both on the left and the right side, and there are no abnormalities with the patient's cornea, both the left and the right side. So sclera and cornea is normal. Now we're going to proceed to assessing the patient's iris. So the patient's iris is dark brown in color. Both iris are of the same size, so the normal iris size should be 10.2 millimeters to 13 millimeters. Now we're going to proceed to checking the constriction of the patient's pupils. So I've dimmed the light. So ma'am, I'm going to check your eyes again. So I'm just gonna shine a light on your eye. Is it okay with you? Okay, so I want you to look at that object right there. So just look at that for the moment. Okay, I'm gonna start, okay? So the pupils are constricting. So both the left and the right pupils are constricting, as it should, and it is normal. So now we're gonna check for the accommodation of the pupils. So ma'am, I'm gonna shine a light on your eye again, okay? So I want you to look at that object again. Just look straight ahead. So I'm gonna start, okay? Okay. So both pupils are still constricting, the left and the right. Both are responsive to the light. So now, ma'am, I want you to look at my finger as I shine a light on your eye, okay? So, okay. Just focus on my finger. So both pupils, the left and the right, are still constricting and reactive to the light. So it is normal, it has accommodation, and it is responsive to light. So what I'm gonna do is I'm gonna show fingers on the side while one side of your eye is covered. So you're just gonna tell me how many you see, okay? So let's start. Can you cover your right eye for me? Okay. So could you tell me how many fingers there are?
1,
How about now?
2, 1, 1.
Okay. Could you blink for me? Okay, now cover the other side of your eye. Okay, so how many fingers are there?
1, 1, 2, 1.
Okay. So patient can identify how many fingers there are. Now we're gonna proceed to assessing the patient's ears. So I'm just gonna see if your ears is leveled to the sides of your eyes. So the patient's pinna of the ear is almost at level of the patient's eye. So now we're going to palpate for the patient's cartilage and mastoid process. So ma'am, I'm gonna touch your face again. Is it okay? Okay. So do you feel any pain as I touch it?
No.
There seem to be no swelling with the cartilage. Okay, now to the mastoid process. Do you feel any pain?
No.
Any tenderness? Okay. There are no swelling and no masses. So cartilage and mastoid process is normal. So now we're gonna assess the patient's ear canal and tympanic membrane. So I'm gonna touch your ear, okay? Up and back. Do you feel any pain as I'm pulling in your ear?
No.
So patient's ear canal is same with the color of the ear, and there are no presence of foreign bodies. There is cerumen or wax, which is totally normal for the patient. So we're gonna proceed to the other side. Up and back. Do you feel any pain as I touch your ear?
No.
So patient's ear canal is the same color as the ear. There's no foreign bodies. There's the presence of cerumen or wax, which is totally normal. We're gonna proceed to assessing the patient's nose. So patient's nose is in the middle of the face or midline. There seem to be no deviations to the left or the right. Septum is normal. Both nostrils are normal. So now, ma'am, we're going to occlude one side of your nostril. So could you occlude it for me like this? So, okay. So inhale and exhale. Okay. Do you have a hard time breathing?
No.
Okay, now for the other side. Do you inhale? Exhale. Did you have a hard time breathing? So patient can breathe perfectly normal even if one side is occluded, so there is no obstruction in the nose. So now we're going to palpate the patient's external nostrils or nares. Do you feel any pain as I touch it?
No.
Okay. Now we're going to proceed to checking the patient's internal nares. So now, Mom, I'm just going to place my hand on your forehead and then tilt it back a bit, okay? So, okay. So patient's nasal mucosa is pinkish in color. There are no swelling, no foreign bodies. There are no presence of exudates. There is also no septum perforation. We're going to proceed to checking the patient's sinuses, the maxillary and the frontal. So, Ma'am, I'm going to touch your face again. Is it okay with you? Okay. Make sure to disinfect your hand before touching the patient. So there seemed to be no swelling. Was there any pain?
No.
Okay. So now we're going to proceed to inspecting the patient's frontal sinuses. Do you feel any pain?
No.
Okay, so there are no swelling and there is no pain as per the patient. So now we're going to proceed to check the patient's mouth and lips. So can I touch your face? So patient's lips are symmetrical, both the left and the right, and there is no lesions, no bleeding, no edema, or any problem with the lips. So can I touch your lips?
Mm-hmm.
So wear your gloves as you do this. So patient's lips are soft and smooth. So now we're going to proceed to checking the patient's teeth. So Mom, could you smile for me? Could you open your mouth, please? So there are 28 teeth, which is normal for a 13-year-old girl like her. The dominant color of the teeth is white and there's no malocclusion. Could you please stick out your tongue? Okay. Could you please stick it out? Okay. So I'm gonna wear my gloves. I'm gonna touch your tongue, okay? Do you feel any pain? There seem to be no swelling, no pain, and no presence of exudate, and the tongue is in the midline. It is not deviating to the left or the right side. So now we're going to proceed to check the patient's uvula. Along with it, of course, is the soft palate. So Mom, could you please say ah for me?
Ah.
So I want you to say ah like really long, okay? Okay. So patient's uvula is vibrating or moving as she says ah, which is totally normal, and it is pinkish in color. The tonsils are perfectly normal. It is around 2.5 centimeters. There is no swelling also on the uvula or the tonsil. Now we're gonna assess the patient's neck. So Mom, Lindsay, I want you to bend your head to your shoulder, both to the left and to the right. Could you do it for me, please? Okay, to the other side. Did you feel any pain?
No.
Okay. So patient could do it effortlessly and with no pain. So now, Mom Lindsay, I want you to bend your head forward and then backward. Okay. Okay. Did you have trouble doing it?
No.
How about any pain?
No.
Okay. So patient had no trouble doing what I said, and she felt no pain. Patient's neck is movable and there are no problems. So just put your hair back. So patient's trachea is in midline position, not deviating to the left nor to the right. There's no visible jugular vein distension. There's also no presence of thyroid lumps. Okay, so patient's neck is normal as per inspection. We're now going to proceed to palpating the patient's thyroid, and I'm going to do the anterior approach. So I'm going to touch your neck, okay? Do you feel any pain? How about here? How about here? Okay. Patient feels no pain. Now we're going to palpate if she has an enlarged thyroid. I want you to tilt your head over. Okay. Tilt it to the other side, please. Do you feel any pain?
No.
So patient feels no pain and there is no enlargement of the thyroid. The thyroid is smooth, pliable, and non-tender. Now we're going to assess the patient's lymph nodes. So I'm going to touch her face again, okay? Okay, so I'm going to use the pads of my fingers to assess the lymph nodes. So we're going to start here. Tell me if you feel any pain as I touch it, okay? Do you feel any pain?
No.
It's okay. So there seemed to be no swelling of the lymph nodes and patient did not complain of any tenderness or pain. Now we're going to assess if patient has neck distension. So I want you to tilt your head a little to the left, please. Okay. So tilt it a bit more. Okay. So as you can see, there is no neck distension. To the other side now. Okay. So there is no presence of the neck distension. So Lindsay, after assessing your head, eyes, ears, mouth, nose, tongue, and throat, all findings seem to be normal, no complaints of any tenderness, and no abnormalities.